Ever had those weird symptoms you just couldn't pin down? Maybe feeling a bit unsteady, really wiped out, or, I don't know, even changes in your mood or how sharp you feel. What if a simple vitamin was behind it? Or maybe you've heard the flip side, that having too much of that same vitamin could actually be, well, a red flag.
It's definitely a possibility worth exploring.
Welcome to the deep dive. In this deep dive, custom made for you, we're digging into the sources you shared all about vitamin B12.
That's right.
Our goal here, to cut through all the noise and give you the really essential stuff about this crucial vitamin, what it does, what goes wrong when levels are off, low, or high.
How it's diagnosed and what the latest thinking is on treatment.
Exactly. Think of this as your fast track to getting properly informed on B12.
Let's get into it.
Okay, let's start right at the beginning. What is vitamin B12, fundamentally?
Well, scientifically, it's called cobalamin. And it's pretty unique for a vitamin because it actually has a metal atom cobalt right at its core.
Cobalt. Interesting.
Yeah. And maybe the most crucial thing right off the bat, our bodies just can't make it. We absolutely have to get it from outside sources.
So diet is everything then?
Mostly, yes. Animal foods are the primary source: meat, fish, dairy, eggs. Our sources do mention tiny amounts on some plants, but that's usually from bacteria, not the plant itself.
So vegetarians and vegans need to be particularly mindful.
Definitely. They need reliable sources, like fortified foods or supplements.
And how much do we actually need each day? Is it a lot?
Surprisingly little, actually. Around 2.5 micrograms for an adult. But here's the interesting part. The body's incredibly good at storing it.
Storing it.
Yeah, you have quite large reserves, something like 4 milligrams total, mostly packed away in the liver and other tissues.
Wow. So that's why.
That's exactly why a deficiency can take such a long time, sometimes years, to actually show up, even so your intake or absorption suddenly drops.
That makes sense. It sort of creeps up on you. Okay, so how does the body even grab it from food and get it into storage? Sounds like it could be complicated.
It's a bit of a journey, yeah. It kicks off in the stomach. Stomach acid and enzymes first have to release the B12 from the proteins in your food.
Okay.
Then it latches onto another protein made in the stomach called intrinsic factor. This whole B12 intrinsic factor package travels way down to the very end of the small intestine.
The terminal ileum.
That's the spot. Specific cells there recognize and absorb the complex. Now, there's also a backup route if you take really high oral doses. A tiny bit can sneak through passively, but that intrinsic factor pathway is the main highway for normal absorption from food.
So intrinsic factor is like the key.
Absolutely essential for efficient absorption from typical dietary amounts. Once it's absorbed, B12 hitches a ride on transport proteins in the blood.
Got it. So it gets in, gets transported. Now, this is where I find it really fascinating. What does B12 actually do once it's inside our cells? What are its big jobs?
It's fundamental. Think of B12 as a vital helper, a cofactor, for just two main enzyme systems. But these two systems, they have really wide-ranging effects.
Okay, lay the first one on us.
Right. The first big pathway uses B12 to help convert a substance called homocysteine into another one called methionine. This happens out in the main cell area, the cytoplasm.
Homocysteine to methionine. Why is that conversion so important?
Well, methionine itself is needed to build proteins. It's often the very first amino acid in a new protein chain. But maybe even more relevant here, methionine gets turned into something called S-adenosylmethionine. SAM for short.
SAM. Okay, what's SAM's role?
SAM is like the body's master methyl donor. Think of it delivering little chemical tags, methyl groups, to all sorts of molecules. And this process, methylation, is absolutely critical for making things like phospholipids for cell membranes, neurotransmitters for your brain, and for maintaining the health and function of our DNA and RNA. It's everywhere.
So if B12 is low, this whole chain reaction just stalls.
Exactly. Not enough B12, the enzyme slows down. Homocysteine can't easily become methionine. So homocysteine levels start to climb and you don't make enough SAM.
And I've definitely heard that high homocysteine isn't good, linked to heart stuff.
Yes, absolutely. Elevated homocysteine is a known risk factor. The sources point to it directly affecting the lining of blood vessels, making them less flexible, promoting oxidative stress, messing with blood clotting factors, basically contributing to vascular problems and increasing heart risk. That's a key link.
And the drop in SAM, how does that connect to the neurological symptoms people get with B12 deficiency, like the memory issues or tingling?
That's a huge piece of the puzzle. Remember, SAM is needed for methylation. Well, the protective coating around our nerves, the myelin sheath, relies heavily on methylation for its structure and upkeep.
Ah, okay.
When SAM levels fall due to low B12, you get faulty methylation. Myelin production and repair suffer. It starts to break down, especially in the spinal cord and peripheral nerves. This nerve damage is a primary driver of those neurological symptoms. The balance issues, the sensory changes, the cognitive problems.
Right. Okay, so that's pathway number one. What's the second big job?
The second main pathway happens inside the mitochondria, the cell's energy factories. Here, B12 helps convert a different substance, methylmalonyl-CoA, into succinyl-CoA.
Methylmalonyl-CoA. Where does that come from?
It's a byproduct from breaking down certain types of fatty acids and some amino acids.
Gotcha. And converting it to succinyl-CoA, why is that important?
Succinyl-CoA feeds directly into the Krebs cycle, which is central to how cells generate energy. It's also involved in making glucose and the iron-containing part of hemoglobin in our red blood cells.
So deficiency means methylmalonyl-CoA, or MMA, builds up.
Yes, it does. And this buildup isn't great either. It can interfere with other processes in the mitochondria, potentially disrupting how cells handle fats.
So if we put it all together, both pathways matter, obviously, but it sounds like the breakdown in that first pathway, the homocysteine-SAM cycle impacting nerves, might be behind many of the most, noticeable or severe symptoms, especially the neurological ones.
That seems to be the consensus, yes. While the MMA buildup certainly isn't ideal, the impact on myelin and brain function through the homocysteine-SAM pathway appears to be the major culprit for many of the classic and often most serious deficiency symptoms.
That really clarifies things. Okay, so is B12 deficiency like a rare thing, or are we talking more common than people realize?
Oh, it's much more common than many think. The sources suggest prevalence rates anywhere from 5% up to even 60% in some groups. It definitely gets more common as we age.
60%? What?
Yeah, depending on the population studied. And that stat from Turkey you mentioned earlier, being the 8th most common reason for a GP visit, really underscores how frequently it comes up in practice.
You talked about absorption problems being key. Are those the main driver for most people who become deficient?
Overwhelmingly, yes. I mean, poor diet is a factor, especially for strict plant-based eaters.
Right.
But the most common reason by far is the body just not being able to absorb B12 properly.
And what causes those absorption issues? You mentioned a few things.
Yeah, lots of potential causes. Stomach issues or big low stomach acid, maybe from aging, or common heartburn meds like PPIs or H2 blockers.
Right, the acid blocker.
Exactly. Then there's a lack of intrinsic factor, that key protein. That's what happens in pernicious anemia, which is autoimmune, or if someone's had stomach surgery, like a gastrectomy.
Yeah, okay.
Problems lower down can do it too. Issues with the pancreas or intestinal diseases like celiac or Crohn's that damage the absorption sites. Even things like bacterial overgrowth in the gut or certain parasites can interfere.
And medications too?
Yep. Certain drugs are known culprits. Metformin for diabetes is a big one. Some cholesterol drugs, even aspirin, according to some sources, might play a role. And don't forget smoking that seems to affect B12 levels too.
Wow, okay, so a whole minefield of things can mess up absorption. Given that and how vital B12 is, what are the actual symptoms someone might experience? It sounds like it could be almost anything.
It really can be a mixed bag, affecting multiple systems. And yeah, sometimes the symptoms are quite unexpected.
What are some of the more surprising ones people might not connect to B12?
Well, on the neuro side, beyond just pins and needles, you can get significant balance and coordination problems, ataxia, difficulty walking, and the cognitive and mental health effects can be profound. Memory loss, confusion, definite personality shifts, even severe depression or psychosis in some cases.
Psychosis, really?
Yes, it's documented. And the crucial thing is, these brain and nerve symptoms can sometimes show up before the more classic blood signs.
Before things like anemia.
Exactly. Many people think B12 deficiency equals anemia, specifically megaloblastic anemia, where red blood cells get big and misshapen because DNA synthesis is impaired.
Right, causing fatigue, pallor.
Yes, all that. Blood tests might show those large red cells, maybe other changes like high bilirubin or LDH. But, and this is really key from the sources, maybe a third of patients don't have the large red cells, especially if they also have iron deficiency or thalassemia. And even more importantly, you can have serious, debilitating neurological problems even with a completely normal blood count. No anemia, no large cells. So just checking for anemia isn't enough. It can miss significant deficiency.
That's a critical takeaway. Okay, so we've got nerve damage, cognitive issues, mental health changes, heart risk via homocysteine, potential anemia. anything else?
Digestive issues aren't uncommon. Constipation or diarrhea. A classic sign is atrophic glossitis, a sore, smooth, kind of beefy red tongue.
H.
Yeah. And in babies and kids, it often shows up as developmental delays, problems with growth, movement, maybe apathy, tremors, poor appetite. In severe cases, infants can become quite ill.
It really touches almost every system. Okay, given this huge range of symptoms and the fact that anemia isn't always there, how do doctors actually diagnose B12 deficiency reliably? It sounds tricky.
It can be. The usual first step is a blood test for the total B12 level in the plasma. Yeah. But as we've hinted, that test has limitations.
Why? What's the problem with it?
Well, there's quite a bit of measurement uncertainty. You can get false lows, results that look low but aren't true deficiency, due to things like pregnancy, folate deficiency, even high vitamin C intake.
Okay.
But maybe more worrying are the false normals, where the level looks okay on paper, but the person is functionally deficient at the cellular level. This can happen with liver disease, certain blood cancers, autoimmune conditions, often because these conditions ramp up the B12 binding proteins in the blood, making the total level look adequate, even if the B12 isn't getting where it needs to go.
Right, so the number looks okay, but it's not actually usable B12. So if that standard test is unreliable, what's the better approach?
When deficiency is suspected, especially if the B12 level is in that gray zone, say 100, 400 pgml, or if symptoms are present despite a normal B12, the next step is usually to check homocysteine, HC, and methylmalonic acid, MMA.
Ah, those metabolites from the pathways we talked about.
Exactly, because remember, HCC builds up if the first pathway stalls, and MMA builds up if the second pathway stalls. They directly reflect whether B12 is doing its job.
So they're more functional tests.
Precisely. Elevated HC or MMA or both are much more sensitive and specific indicators of a true functional B12 deficiency. The sources cite high accuracy, like 94% sensitivity, 99% specificity. There's also a newer test, holotranscobalamin, or holo-TC, which measures the active B12 bound to its transport protein and might pick up deficiency earlier.
That makes so much more sense, Check. If the machinery is actually running properly, are there guidelines on who should get screened?
Yeah, general recommendations often include annual screening for folks over 65, maybe every 5 years for those 50, 65 if levels are good. But really, anyone with significant risk factors should probably be checked regardless of age.
Like?
People with autoimmune conditions, especially pernicious anemia or thyroid disease, those with celiac, Crohn's, anyone who's had stomach or bowel surgery, long-term vegans or vegetarians, and definitely people on those interacting medications like metformin or long-term acid blockers.
Okay, so once it is diagnosed, how is it treated? Is it always injections? That's what I always thought.
Well, the good news is treatment works really well, often quite dramatically fast. And traditionally, yes, injections intramuscular or subcutaneous were the standard, especially if absorption was the problem.
That's changing. This is where things get really interesting for you, the listener.
Oh, absolutely. This is a major shift highlighted in the sources. There's now strong evidence from multiple studies showing that high-dose oral B12, typically 1 to 2 milligrams daily, is just as effective as injections.
Wait, even for people with pernicious anemia or other absorption issues, how can that work if they lack intrinsic factor?
That's the fascinating part. Remember that minor passive diffusion pathway. While it doesn't absorb much from the small amounts in food, these oral doses are so high, like hundreds of times the daily requirement, that enough B12 gets absorbed passively across the entire intestinal lining to fully correct the deficiency, completely bypassing the need for intrinsic factor.
That's incredible. So the dose just overwhelms the system in a good way.
Pretty much. And this shift to oral therapy is really appealing for several reasons.
Like what?
Well, it's way more convenient for patients. No shots, no clinic visits, just for an injection. It generally has fewer side effects, it's significantly cheaper, and studies show patients prefer it. It offers a really valuable alternative.
So what do treatment plans look like now then? Is it injections or pills?
It often comes down to severity, cause, and patient preference. For injections, a typical start might be daily shots for a week or two to load up, then weekly, then maybe monthly for life if it's pernicious anemia. Severe neurological symptoms might warrant longer initial daily shots. For the oral route, it's usually straightforward. 1 to 2 milligrams, taken daily. Again, often lifelong if there's an underlying absorption problem that won't go away. The most common form in supplements is cobalamin because it's stable, but the body easily converts it.
So really effective options now. Okay, we've covered deficiency, inside-out symptoms, diagnosis, and new thinking on treatment. But you mentioned something earlier that feels counterintuitive, that high B12 levels can also be important.
Yes, exactly. This is the other side of the coin, and it's often missed. People tend to think more is better with vitamins, but finding unexpectedly high B12 in the blood can actually be a signal that something else needs looking into.
How would someone end up with high levels, apart from just taking massive supplement doses?
Supplementation is one possibility, sure. But often, high levels point to one of two things. Either a large release of stored B12, usually from liver damage, or an overproduction of the proteins that bind B12 in the blood, the transcobalamins or heptacorin.
And these high levels are linked to specific diseases?
They can be associated, yes. They can act as a marker. There's a pretty strong link, especially with very high levels, to certain blood disorders.
Yep.
Chronic myeloid leukemia, CML, is a classic example, but also other myeloproliferative neoplasms and sometimes lymphomas, often because the cancer cells are churning out excess binding proteins.
Wow.
High levels are also common in liver disease, acute hepatitis, cirrhosis, sometimes even early liver cancer. This might be from damaged cells releasing B12 or the liver not clearing it properly. The sources also mention links to some solid tumors, lung, breast, kidney, bowel cancers again, possibly due to the tumors making binding proteins. There was even a stat about potential increased prostate cancer risk with high B12. And it can show up in some autoimmune diseases or kidney problems too.
So let me get this straight. The high B12 isn't usually causing the cancer or liver issue itself. It's more like a symptom or a flag.
That's generally the understanding, yes. In most of these cases, the high B12 isn't thought to be harmful directly, but adds a clinical clue. Finding it unexpectedly high prompts the doctor to investigate why. Is there an underlying blood disorder, liver issue, something else? It's a signal.
That adds a whole other dimension. Okay, we have covered a ton of ground here.
We really have, from the basic molecule cobalamin and its surprising storage ability.
To its two core jobs affecting nerves, DNA, energy.
And how glitches there cause such varied symptoms, from fatigue to serious neuropsychiatric issues.
We've looked at why diagnosis needs more than just the basic test.
And highlighted that big shift towards effective high-dose oral treatment.
And finally, touching on the less discussed significance of high B12 levels as potential disease markers.
A pretty comprehensive look.
Hopefully this deep dive has genuinely given you, our listener, that shortcut to really understanding the key insights about this incredibly important vitamin.
I hope so too.
And maybe just a final thought to leave you with. Isn't it kind of amazing how this one single vitamin, B12, connects to such a vast network within our bodies? From our DNA and nerves to mental well-being, heart health, even potentially flagging cancers or infections.
It really highlights the intricate web of biology.
It really does. And understanding one piece, like B12, can illuminate so much more. Makes you wonder, doesn't it? What other essential nutrients might hold similar unexpected twists and connections, just waiting for us to explore them more deeply?